Good afternoon to all. So I'll be presenting my study, Protective Behavior of Time Spent Outdoors on Myopia Progression in Children. It was a longitudinal study. So we know that myopia has emerged as a significant public health problem across the globe because there has been a rapid increase in the prevalence of childhood myopia over the past few decades. And we know that there are genetic factors which play a significant role in myopia onset and progression, but there are some environmental factors also which are associated with lifestyle which may have impact on myopia. And there is a positive longitudinal studies in the literature to ascertain the effect of environmental factors on myopia progression. So we have studied environmental factors on myopia onset and progression. So the study was done to determine the influence of time spent on outdoors in daylight by children on myopia progression, and patients were followed prospectively longitudinally. So it was a hospital-based longitudinal observational study done over a period of 2 years at a tertiary eye care center. And we included children like 6 to 14 years presenting with decreased vision in the OPD, or children with myopia of -0.5 or worse. And we excluded patients with refractive error other than myopia, with family history of myopia, or having anterior posterior segment disorders. We excluded them. So total 580 children were enrolled for the study initially. All children underwent cycloplegic refraction and glasses were prescribed. The spherical equivalent was calculated for all the children. And these children were followed every 6 months for 18 months. And at every visit, 6 months, cycloplegic refraction was done and spherical equivalent was calculated. Parents were asked to record the time spent in outdoor activity in daylight of their child in hours per day at school and at home during weekdays, weekends, and separately on a calendar provided to them at the start of the study. And they were asked to bring this record of activity at every follow-up in the hospital. Time spent outdoor activity in daylight was defined as playing on the ground during a break period in the school, or playing outdoor sports, riding a bicycle, running, playing in park, or even sitting in daylight was considered as a time spent outdoors. So time spent in outdoor activity per day was calculated every visit by dividing the total hours of outdoor activity in a week by 7. And these children were divided into 4 age groups. This is the methods which we use for statistical analysis of all the patients. A total of 495 participants completed 3 follow-up visits during the study period. So we include only those participants. And this table shows the descriptive profile of all the participants along with their spherical equivalent and outdoor activity in the hours across the 4 visits. It showed at baseline activity what was the score and what was the score at the 3 follow-up visits, these myopia as well as the hours of outdoor activity. And the inter and intra-individual association between the spherical equivalent and time spent outdoor in hours for 3 visits was determined by repeated measure correlation. And this repeated measure correlation was calculated as 0.26 minus 0.26, and we showed a statistically significant negative directional relationship between the outdoor activity and the myopia progression. And this is a chart which shows a repeat measure correlation graph, and this chart shows that there was an inverse relationship between the outdoor activity and the time spent, outdoor activity in the myopia progression, and this dashed line in the center represents the overall negative correlation between the outdoor activity and the myopia progression. Then we calculate the magnitude of relationship between the two parameters by a mixed effect model method, and this estimated the effect of per unit time spent outdoors to change in spherical equivalent in subsequent visits after adjusting for baseline activity and their age category. And we found that each hour increase in outdoor activity per day, means every extra hour spent outdoors, had a negative effect on change in spherical equivalent by 0.6 diopters on a subsequent visit as compared to last visit. Now this 0.6 diopter change may not be clinically significant, but statistically it was found to be very significant. So our study findings are closely in line with Sydney myopia study, which suggests a protective role of time spent outdoor activity in myopia in 12-year-old children. It was a cross-sectional study. Then North India myopia study was conducted on prevalence of myopia with significantly less in children who were playing more than 2 hours outdoor in day. Another study by Sherwin et al. Indicated 2% reduced odds of myopia for each additional hour spent outdoor weeks. But all these studies and other studies in literature are either cross-sectional or they're randomized studies. So the mechanism underlying a protective effect of outdoor activity and light exposure remains unclear, but there are studies in literature which shows that release of myopia from the retina on exposure to daylight, and this increased level inhibits the elongation of the eyeball. That may be the mechanism of the reduced myopia progression in children who are spending more time on outdoor activity. Our study has multiple strengths. Like this study had minimal recall bias, because other studies which are done, they were question-based studies. Question were asked to the parents how many hours child is spending, but here we had documented, given a chart to the parents to record the activity of the break period in the school and at the home also. So don't recall biases were minimum. It was longitudinal study, follow-up study, where a causal relationship can be established between the outdoor activity and the progression myopia, where other studies are cross-sectional or randomized control trials. We have a large sample size of 580 children. Limitation is that is institutional in nature. So the results cannot be finding being exploited to the population. So to conclude, increase our time spent on outdoor activity at home and school may be a simple strategy to prevent onset and progression of myopia in school. And to our knowledge, is the first hospital-based longitudinal study which was done in cohort of children presenting to tertiary care center. We have published this also in IGO, and implications that we can ask the children to spend more time in the outdoor, and school, this can be added to the curriculum of this school to spend more on the break periods when the children go to outdoor in the daylight to spend activity, more time in daylight, because myopia is becoming epidemic in India and across the globe also. The incidence is increasing in India also, around 13% studies show. So this can be an additional therapy besides the low-dose atropine and other therapies which are going on to prevent the myopia progression. Thank you.
This is a nice study, because till now we were seeing the more they see the mobile, more they do the close activities, they increase the myopia.
Screen time is more in children.
So this is the positive study. Yeah. Second thing, have you asked of those children about the study period? How much they are studying?
School, we have calculated how many hours they are studying in the school. And
because with the study reading, these outdoor activities should be calculated.
Yes. So we have got the indoor time in the school was fixed for all the children.
And from 6 to 14 years you have done?
Yes, madam.
So this will be overburdened, 14 years one will be overburdened by the studies.
Yes.
So is there any change?
But the school myopia usually occurs, madam, in this school children. That's why we have taken this sample size.
How did you adjust for the confounders? Because like ma'am said, near vision activities, then
madam, the near work during the school period was fixed for all the children because they have almost same curriculum. So we didn't take that into consideration.
Like parental myopia, parental
That we
education, all
excluded by
those
excluding
risk
the
factors.
families. We excluded parental myopia. No? We excluded patients who had children who had myopia in the family. So genetic factor we excluded. So we took only environmental factors into consideration, the lifestyle.
What is the recommendation per week of outdoor activity?
2 hours per day is the recommendation, madam. 2 hours per day, 1 hour like in school if they have, and 1 hour at the home, and daylight, not in the evening hours, because the daylight has the effect of increasing dopamine. So 2 hours is recommendation of the many studies. So at least 2 hours per day, child should spend outdoors in any of the activity, and that will help in reducing the myopia progression, besides the other measures which are being taken to reduce the myopia onset and progression, like atropine study and other atropine therapy and other studies.
It has been seen that 11 hours per week also is a protective
2 hours
thing.
per week, yeah.
11 hours per
Yeah,
week.
per week is enough.
And are you aware of any objective methods of measurement of the outdoor light?
Yes, there are devices which are fitted into the spectacles, which measure the amount of light which is child is exposed to. So there are objective measurements are there. There are studies which are measuring with the spectacles, some device in the spectacles.
Thank you.
Hygiene is very important.
Yes, yes. Yeah.
You know that in America they have banned the
Screen.
mobile for the
For the children. They have banned at particular age, the children are not allowed to use.
mobile. Not only does the myopia progression, that mobile and bending of the head
The posture-related problems.
increases the length of the eye bar, and dryness is one feature which is coming
Because of
problem
the-
in children also.
Because of less blink rate
Because
and
of mobile.
yes. So COVID time it was very high.
Because when they look at the screen with the TV or anything, they blink much less.
Yes.
Than we all do.
And there are studies which show before COVID and after COVID times.
Computer is also a problem.
There are studies.
They were not using.
No. And there are studies before and after COVID times. They found COVID times they had all homework on the mouse, so there was increase in the myopia after COVID times. Thank you so much.